Thank you. I think I'm quite astounded by this, like where you actually, it's a very big room and you don't notice until you stand up here. I'm also not entirely from tech. I'm a little bit of a pretender, okay? I spent 15 plus years of my life in insurance. And then the last 2 years, I saw the light and I wanted to help people, all right, give back to society as well. So I moved into the health tech space. So I'm going to share with you a little bit more about healthcare, the ecosystem, okay? And we're going to have a little bit of a journey, hopefully. Around some of the key topics that I think is worth discussing, okay? So we're going to talk about how healthcare is quite a decentralized, fragmented industry. We're going to talk about the importance of why it's omni-channel, okay? And how we can't do without that aspect in healthcare. Some of the challenges, because of the audience, I'm going to talk a little bit about data exchange, privacy, and security. Obviously, very important to keep your patient data safe. And then a topic a little bit closer to home, which is HealthierSG. Some of you guys may have heard about this, come across this, but I want to bring it to your attention, mainly because it's relevant in terms of a data connectivity point, but also it will impact directly your lives if you do live in Singapore, okay? So very simply put, hoping most of you guys can see this, this is the wonderful healthcare landscape that we live in, okay? And this is not just unique to Singapore, but in most countries across the world. What we have on the left-hand side is the patient persona. We all know and love these people, okay? These are your parents, your children, yourselves. You may be sandwich generation. You may be a chronic user, okay? You may be very healthy, which I hope you are. And then you go into areas where, for example, you can segment these people like global travelers, and you have aging citizens, but you also may be an athlete. And so all of these people's needs are very different, and you have a different challenge when you reach out to the healthcare ecosystem. When we talk about providers, again, starting from the top, we start from tertiary care into secondary care and straight into primary care, which are GPs and some of the specialists that we interact with on a day-to-day basis. But we also have a lot of touch points with some of our other partners, such as allied health, okay, physio, cardio, psychiatrists. Then there's labs, there's pharmacies. There's a whole spectrum of providers that we will need and talk to in our lives, okay? There is one persona that many, many people forget exists in this healthcare ecosystem, and that is the payer. Who pays for your healthcare? Now, I will touch on this a little bit, but this is a very difficult topic to touch on because it's no simple answer. It could be yourself if you're unfortunate enough. You could have your company pay for you. You could have private insurance if you can afford it, okay? Or you can live in a country where there is a very, very nice base standard of healthcare coverage, okay? So this is the fragmented nature. No one talks to each other, you're on your own, all right? This is what I want to paint a picture of an omni-channel solution, okay? This is what an omni-channel healthcare solution should look like. And if we start on the left-hand side there, everyone, when they are ill, starts by going to the GP. Whether you teleconsult or whether you go to your local GP, you start on the left-hand side. Now, this is where the journey gets a bit more interesting. If you wanted to have a strategic plan to achieve a goal, for example, you wanted to lose weight, okay? This could be a wellness plan for you. I go to the GP, he says, Hon, you are overweight. Please sort this out. Check your BMI, track it every day, please, okay? I track my BMI. He gives me step challenges. Step challenges, Hon, please do 9,000 a day. Right, okay. And I want you to take a certain nutrition plan, okay? I want you to do a certain amount of fitness with a certain amount of partner, okay? Come back to me in 4 weeks. 4 weeks' time, come back, all my data is there, okay? It's either inputted, which is a not very nice way, or it's automated and seamless with your wearables, for example. 4 weeks' time, I come back, my doctor then says, Hon, you've not reached your goals. I'm going to have to ramp this up, okay? He says, I'm going to increase your step challenge. I'm going to increase your nutrition or reduce your nutrition intake. And I'm also going to now prescribe you a personal trainer, okay? With this, he also consults with the endocrinologist. and starts the discussion where maybe I do not reach my goals and maybe I need medical intervention, okay? At week 8, again, the GP then maybe brings other people in and so on and so forth until we get to a point where I've either reached my goals or not. I'm either still obese or I've reached a nice healthy weight, okay? This is where technology comes in and out of how we serve and let consumers consume healthcare services, okay? On the far right-hand side there, this is no longer technology. If you really need a gastric band, then I think you're in all sorts of different trouble, okay? So what do we need to make this omni-channel flow a reality? We've probably seen this before. This is at the back of many doctor's surgeries, okay? Your healthcare medical data resides in one of these folders. That's what you are. You are a health record, okay? And this is something that unfortunately does occur across the world. So what should it look like? If you take a picture of yourself right now, you can look at it and you can see what your health is like at this point. But tomorrow or next month or 6 months or 12 months, I could look very different. So it's actually static and it's actually irrelevant, okay? What we need to do is to be able to connect all sorts of medical data, which can be taken in various timeframes and cadences. These can be height, weight, BMI, your blood pressure, lipid profiles, any kind of vaccinations you've done, boosters, for example, and any screenings that may have taken place, and collect it and put it into one source. Overlaying that with day-to-day data, which typically can come from wearables or IoT. Okay, so these will track things like my steps, my sleep, how my heart rate is, okay, what's my resting heart rate, and so forth. With these two, we now can provide people with a much more accurate health index of themselves. How healthy are you really? And if you are not, then what are the steps and actions that need to be taken? Okay? Medical notes, as we just saw, are scattered everywhere in various formats. Okay? And the idea is to try to have one source of truth. I come from the UK. My dental is in the UK. My health records are in the UK since I was a child. I've been here for 8 years, but I also moved 4 different places around Singapore, 4 different GPs, 3 different dentists. The first one didn't like me, so it doesn't count, okay? But the idea is that my health record is nowhere. If I wanted that really expensive x-ray that I took 6 years ago, that dentist that doesn't like me anymore, I don't even know where to find him anymore, okay? So what are the challenges? We don't have our data, as I just mentioned, and we don't know where to get it. The vaccination I took for Hep B, I don't know if it's valid or not anymore. I don't know if I need a booster. I don't know if my son does either, okay? This is bad now, okay? I don't know how to access. I don't know what specialist to go to. What makes Dr. X better than Dr. Y? Is actually Dr. Y the right person to see? Maybe. And then there's one that resonates a little bit close to my heart, okay, and that's payment, okay, money, all right? We always ignore this part because many people are fortunate enough to have companies or governments or private insurance to pay for this, okay? But even if that is the case, there is still a whole background of people and armies of people sorting out our healthcare, which is not the right way to do it, okay? So I'm going to put a few slides just on who pays for this, okay? I promise, don't fall asleep on me, okay? Who pays for it? Right, start universal healthcare. People may have heard about this. Universal healthcare is very simple, okay? It's access to healthcare services that are higher quality, and one that basically means you don't need to remortgage your house to get healthcare, all right? So it doesn't bankrupt you. This is universal healthcare. Only 2 countries in the world provide true universal healthcare, Canada and Taiwan. Only 2 countries in the world. If we go to mandated, it's exactly what it says on the tin, okay? This is mandatory insurance that the country says, if you come to my country, you buy insurance. Don't pass go, don't collect 200, you buy insurance first, okay? These are the countries at the top. and they require you to buy it from a public or private insurance company. All right. Hybrid system is a bit of both. All right. We give you a little bit of everything. So they give you a base level of care, okay, but then they encourage you to upsize, okay, buy insurance to give you a much more holistic cover, okay, and this takes the pain away from the infrastructure of the country, okay. So what we need to do is we need to connect these, but the takeaway is that the payer in any given country is different from the next, okay. Market by market is different. So you can tell where my PowerPoint now starts. I started drawing this, okay? The three personas in this triangle I explained already. And the interconnection between each one is not simple. It's not one simple black arrow. It's a myriad of emails, faxes, letters, and all sorts of doctor's handwriting, okay, that are illegible. It's complex enough. On the right-hand side, this is the most basic flow that I could find, explain how someone pays a provider, okay? Now, if you are a corporate provider, this complicates the matter even more, because what we have now is an insurance company, and they're very complicated, to provide complex insurance to the corporate employee, all right? And then it typically have to go through an intermediary. This is the gold chap in the middle here, the broker, okay, the agent, if you want to call it that. And again, now we have another actor in this story, okay, and it adds a tremendous amount of complexity now. These are not unilateral conversations, these are bilateral conversations, okay, bilateral exchanges of data, all right? This is me dreaming ahead of a world that solves this problem, okay, and it's horribly simplistic, okay? We have insurance companies at the top. They have policies. They're very complicated and they're wordy and they have lots of long words in there that no one really understands and they're in very small font, okay? These are your policies. And then you have the providers. These are doctors. They are also very complex individuals, okay? And when you add these two together, something is or isn't covered. It's that simple. But no one can actually tell unless you have a human being sit there and read it 8 times and then try and figure it out. What we need to do is simplify these insurance policies. The bills need to be able to be translated into digital logic. You put the two together, okay? You put it through like this amazing company that my system that my company does, all right? And then you have a process claim, just like that. And then you get paid. So everyone is ultimately very happy at the end of the day. Now, there's 4 boxes here, and it's very simple. But the takeaway point is that this is what it should be, okay? No more complicated than this, okay? And with technology, sometime before I retire, I wish to see this, right? Okay, now back to the topic in hand. The fast healthcare interoperability resources by HL7. Okay, now this is getting to the very depths of my tech understanding here, right? For ones of you that at the back that can't read, the FHIR is how it's pronounced apparently. Set of standards is a set of rules and specifications for exchanging electronic healthcare data. It is designed to be flexible and adaptable so that it can be used in a wide range of settings and with different healthcare information. Sounds amazing. Sounds great. But there are problems. And these are quite similar problems to ones that where Yi presented earlier. Okay, and also why I raised the question of why would I want to join? Okay, FHIR side, okay, HL7 heavily used by a lot of the EMR systems across the world. Okay, electronic medical records. For Singapore public health, unfortunately, IHIS, who run the public side of things, aren't very disciplined at adhering to exact standards, so to speak. Okay, they have their own standards. And when they adopted HL7 standards, they started using segments in all the wrong manner. Okay, so they tried to take the nice parts and then they ignore the rest. And then when you take something and don't use it for its intended purpose, you usually get a very poor outcome. Okay? So adoption is very dependent on a number of factors that are sometimes within your control but unfortunately, most of the time it's out of your control. Cost is a big one. Okay, the acquisition cost of the documentation for integration to FHIR, okay, is very high. So unless you have a very deep-pocketed institution that you are working with, or that you manage to find a documentation lying on the side of the road, it's out of reach for many people. Okay? With patient data, this is possibly more important and sensitive than your bank data. If you find out how much money is in my bank, you'll probably laugh, not in a good way. If you find out things about my personal life and my health, that's even worse. So security is at the utmost importance. People who want to adopt FHIR need to ensure that they either maintain or enhance their existing security measures required to protect patient data. Now, as we saw earlier in that picture, okay, if I lit a match in there, that security level of security is clearly not sufficient. Okay. We also talked about the fact that I may not be from around here. Okay, so now we're talking about cross-border data exchange. Okay, and that's an area where people have to figure out how they remain on the right side of the law. Okay, political. This is an interesting one. Healthcare is quite a hygiene factor service, but it's political. One medical provider can provide a service. There's only two people that own that data. That is the patient and the doctor, no one else. Now, if I have your medical record, I have power, I have data. I'm not willing to share it, okay? If you go to Fullerton and ask them to share it with Raffles, they will laugh at you. If you go to Raffles and ask them to share it with Parkway, they will laugh at you as well. These guys are one of these where they laugh at each other and talk and have a drink, but behind their backs, there's a knife, okay? So they don't want to share necessarily, and so the incentive is not there, okay? Which comes, I'll touch on this next, okay? And then the infrastructure, okay? Yes, we're in Singapore, we have a very high level of base technology here, but you go to other parts of Southeast Asia, it's a different game, completely different game, okay? So infrastructure in some of these areas may require heavy investment as well. And depending on the size of the organization, it may not make it worthwhile. If it's a big organization with already infrastructure involved, they may actually just wait for end of life. Okay? So again, it's a nice to have, it's not a need, it's not a want. Okay? Okay, HealthierSG. This is a Singapore nationwide major transformation of the healthcare service system. Okay. The sole aim of HealthierSG is to reduce the burden on the system as the population ages and people live longer. This is not a problem that is unique to Singapore. In fact, most Asian countries are suffering from this problem. Japan is actually ahead of the curve on us. Okay. The focus of HealthierSG is to be reactionary healthcare. Okay, is that we are too reactionary to healthcare. When we are ill, we go to the doctor, and then the doctor says, "Well, you need to go to hospital." Then a whole journey ensues after that. The idea is to move away from that idea, that process, and go into a proactive, preventative way of healthcare. I want to keep you healthier for longer, so you do not have to burden the healthcare system, okay? And this has a number of ramifications which I think are great, okay? It's like a good hangover, all right? What happens is that they thought, okay, in order to do this, we must change the world a little bit. See, healthcare has always been very doctor-centric. You go to see the doctor. You wait for the doctor owns your data. Okay? The world revolves around doctors. With HealthierSG, with new incentives and innovation to actually allow users to be patient at the middle of their own journey, this is now changing. The PHR that I showed you earlier allows you to control your own healthcare, all right? But it's not that simple, okay? We still need these people to talk to each other. So the way that Singapore thought, how do we do this? Well, there's only one way we're going to do it. We tried the carrot, now we try the stick, okay? So they invented a team-based care approach to healthcare in Singapore. It's based on the family doctor model, okay? Your local doctor around your corner. Then there is a peripheral amount of service that help the doctor provide the care that you need. Nurses, okay? Allied health, care coordinators, pharmacists, and so forth, okay? But the problem that we have is that these guys still don't talk to each other. And so this is why I brought this to your attention regarding data collection and connectivity, okay? Data will be centralized in Singapore, okay? And it will be mandated by passing the Health Information Bill in Parliament, which is imminent. It's already in discussion. It's basically a rubber stamp exercise here on out. Every provider in this new ecosystem has to share the data of that patient to the government, okay, to what is called NEHR, the National Electronic Health Register. Your data, be it from your GP or a specialist or from a laboratory or from a health screening that you got somewhere, will be collected in one source of truth now. And this is happening in the background. So with HealthierSG, it will fix problems, but it will also bring problems as well. Telling family doctors to now provide data to of their patients to a central repository has had some mixed reactions, shall we say. So it remains to be seen somewhat if this will work. I think with Singapore and their history and experience of mandating things, it will typically work. Okay, and the adoption needs to be actioned at government and ministerial level. Again, this is something that is not easy to do, but deemed necessary to save the country and ensure that the future remains bright. Okay, so quick summary. All the stakeholders need a clear requirement and a mandate to work together. The two personas that are important, payers and providers, need to connect. The omni-channel experience has to be there. If there is no user adoption, this does not work. If people start splintering off, okay, then this also doesn't work. And the final one is exactly that point. They are the driving force behind the success of